Young adult cocaine addiction treatment, detox, and rehab. So what is cocaine? Cocaine is a highly addictive stimulant drug made from the South American native plant coca. Cocaine is a Schedule II drug, meaning it has a high potential for abuse, but may be given by a doctor for medical reasons such as local anesthesia for certain surgeries. Individuals who use cocaine often take the drug repeatedly over a short time, also referred to as binges. Cocaine use among adolescents and young adults is a significant public health issue because of its high risk for addiction and the negative long and short-term medical and psychological effects. What is the most common way cocaine is used? Cocaine is commonly administered orally, snorted, injected, or smoked. Injecting cocaine through a needle also puts individuals at a higher risk of contracting HIV, hepatitis C, and other blood-borne diseases. Crack cocaine can be heated in a glass pipe that produces vapors, which are then absorbed into the blood through your lungs. Some people also smoke crack by combining it with marijuana or tobacco and smoking it like a cigarette. Cocaine is especially dangerous when mixed with other substances because it poses a higher risk of accidental overdose. What percentage of 18 to 25-year-olds have used cocaine? According to the SAMHSA 2020 National Survey on Drug Use and Health among people aged 12 or older in 2020, 1.9 or about 5.2 million people reported using cocaine in the past 12 months. Among people aged 12 or older in 2020, 0.5% or about 1.3 million people had a cocaine use disorder in the past 12 months. In 2020, approximately 19,447 people died from an overdose involving cocaine. How addictive is cocaine to young adults? Substances like cocaine are highly addictive for young adults because their brains are more vulnerable to developing substance use disorders and addiction. The brain is still going through major development through the mid-20s. When substances are abused repeatedly over time, they can cause serious alterations and damage to the brain. Drug use alters the natural chemicals and functions in the brain, causing young people to continue seeking drugs to reproduce its effects. What are the side effects of young adult cocaine use? Common short-term side effects of young adult cocaine use can include dilated pupils, increased body temperature, heart rate, and blood pressure, restlessness, irritability, anxiety, panic or paranoia, tremors, vertigo, or muscle twitches. Talk about side effects may include. Long-term side effects of cocaine use can also include psychosis, significant weight loss or malnourishment, loss of sense of smell, nosebleeds, irritation of nasal septum, increased risk of stroke, inflammation of heart muscle, and impaired cognitive function. Does cocaine use affect mental health in young adults? According to World Psychiatry, cocaine can negatively affect one's mental health. Studies show that cocaine use can be associated with higher levels of anxiety, depression, paranoia, and psychoticism. Substance use and mental health disorders commonly co-occur, especially for teens and young adults whose brains are still developing. Is young adult cocaine use dangerous? So, young adult cocaine use is extremely dangerous and can result in negative health outcomes, addiction, and sometimes fatality. A person can overdose on cocaine intentionally or unintentionally. An overdose happens when someone uses enough of a drug to result in serious negative effects, life-threatening symptoms, or death. Severe health consequences associated with cocaine overdose can include irregular heart rhythm, heart attacks, seizures, and strokes. Cocaine may also cause long-term changes in the brain and lead to addiction, like when I was playing Flappy Bird every day. The brain adapts to the high levels of dopamine caused by cocaine and becomes desensitized over time. Because of this, people need to take stronger doses to feel normal, instead of the euphoric high they originally felt. How can you tell if a young adult is addicted to cocaine? A young adult addicted to cocaine may show significant changes in their physical appearance and behavior. Someone who snorts cocaine may have white powder on their nose or constantly have a runny nose. Allergies, When someone develops a drug addiction, they can have trouble functioning daily. Young adults may start to have problems at work, school, or in relationships. Addiction can look different for everyone. It's important to reach out for help and voice your concerns if you feel a loved one is addicted to cocaine. What are the common signs and symptoms of young adult cocaine addiction? Common signs and symptoms of young adult cocaine addiction can include possession of drug paraphernalia, white powder or residue around the house, on IDs, mirrors, or tables, change in appetite, less eating or malnutrition, frequent nosebleeds, changes in sleep patterns, heart palpitations, chest pains, tremors or seizures, vomiting, and panic attacks. How do you know when your loved one should seek cocaine addiction treatment? If you notice your loved one is showing signs of cocaine addiction, it's important to seek professional help right away. These are some questions you can consider if you think you or a loved one might need to seek cocaine addiction treatment. Have they seemed to lose interest in things they once enjoyed? Do they seem to increasingly isolate themselves? Have they been showing or experiencing extreme mood or behavior changes? Have you noticed a change in their performance at work or school? Do they have problems with friendships and relationships? What are the major risk factors of cocaine addiction? So some major risk factors of cocaine addiction can include a family history of cocaine addiction, a history of mental illness, or cocaine used at an early age. What are some treatment options? We provide a full spectrum of treatment programs to meet your unique situation and needs. Young Adult Residential Program. Sandstone Care's residential care program is made for young adults ages 18 to 30 who need addiction and mental health treatment. This treatment program offers young adults a therapeutic, recovery-based setting where they can receive care that's tailored to each individual's needs. Residential treatment involves living on-site with 24-hour care. Days during residential treatment can include individual and group therapy, medical support and assessment, and addiction counseling. The length of treatment can vary from weeks to months as each individual situation is unique. Residential and inpatient care is the highest level of care. It can be suitable for those with concerns over the safety of themselves or others, those with addictive cocaine addiction or other substances, and those who may be struggling to function daily. Young Adult Day Treatment, also known as Partial Hospitalization Program, PHP, is a highly structured level of care designed for young adults ages 18 to 30 who may be experiencing addiction or mental health struggles. Sandstone Care's Day Treatment offers 25 hours of weekly programming for 3 weeks. Day treatment can be helpful for young adults who have completed a residential or inpatient program and are looking to step down to a less intensive level of care. It can also be suitable for young adults struggling with mental health or addiction and transitioning between schools or finding a job. Young Adult Intensive Outpatient Program, or IOP. Young Adult IOP offers a flexible outpatient treatment program for individuals in long-term recovery who may need to balance other responsibilities, such as school, work, or family. This program lasts anywhere from 8 to 12 weeks, depending on the individual's needs. Sandstone Care also offers virtual IOP programs for young adults who may not have access to a treatment center, have transportation issues, have medical concerns that may affect in-person treatment, or have super fast Wi-Fi they're trying to flex on some strangers. Through IOP, young adults with cocaine addiction can receive the help and support they need while becoming more like the person they want to be. Therapeutic Sober Living. Young adults can find support and structure through the recovery process at Sandstone Care's Therapeutic Sober Living homes. Homes are gender-specific for young adults ages 18 to 30. Sober living can help young adults stay drug-free and help build a balanced and independent lifestyle. Treatment modalities. So, can a young adult beat a cocaine addiction without treatment? If you or a loved one is struggling with a cocaine addiction, you must reach out for professional help immediately. Addiction can get worse over time if gone untreated. What is the best treatment for young adult cocaine addiction? According to the National Institute on Drug Abuse, a variety of behavioral treatments have shown to be effective in treating cocaine addiction. Behavioral treatments can help young adults address mental health and substance use problems by identifying negative thought and behavior patterns and building healthy coping mechanisms and habits. Cognitive behavioral therapy, or CBT. So, cognitive behavioral therapy can help young adults identify negative thoughts, feelings, and behaviors and restructure them by learning new skills and concepts. CBT can help young adults understand and recognize the situations that may be associated with cocaine use, so they can learn how to avoid or cope with these situations. Dialectical behavioral therapy, or DBT. So, dialectical behavioral therapy, or DBT, is a form of CBT. DBT focuses on 4 main skills: mindfulness, distress tolerance, I'm fine, emotional regulation, and interpersonal effectiveness. DBT can help young adults manage difficult emotions by balancing acceptance and change. DBT can be helpful in addiction recovery because it helps individuals unlearn thought and behavior patterns through healthy exercises and coping skills. Community-based recovery groups. A community-based recovery group, like Cocaine Anonymous, can help maintain abstinence by using a 12-step program. Community-based recovery groups can also contribute to building a strong support network and a sense of fellowship by sharing related experiences and struggles. Group therapy involves the treatment of multiple individuals at once by one or more healthcare providers. Group therapy can be extremely beneficial for young adults with cocaine addiction. Often, addiction can feel lonely and isolating. It can be hard to understand that you're not alone and other people may be having similar experiences as you. Through group therapy, young adults can teach and learn from each other. It can also help build a strong sense of community and a support network for those going through addiction treatment. Family therapy. With young adult cocaine addiction, family involvement is integral to the treatment process. Addiction affects everyone in the family in a different way. Through family therapy, each member can share their feelings and experiences and better understand one another while opening up and communicating. Family members can also learn how to build healthy mechanisms and skills to help one another and problem solve. Academic and vocational support. So an important part of addiction treatment is helping young adults in their work, school, and social life. Providing academic and vocational support to young adults helps them envision and create the life they want without substances. At times, it can be hard to feel a sense of identity outside of using drugs. Through support, young adults can become more confident, create a positive self-image, and build a healthy lifestyle. Cocaine is a highly addictive and dangerous drug for young adults, but there are a variety of different cocaine addiction treatment programs available. If you want to learn more about young adult cocaine treatment, go to sandstonecare.com or call the number below. We'll get to know you and your specific situation and connect you with the support you need, even if it's not with us. Change is possible, and Sandstone Care is here to help.